You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. We're talking about replacing missing teeth with dental implants. With us, we have an expert on the topic, Dr. Skorupko. Dr. Skorupko, welcome to the program.
Thank you so much.
Now, before we get into today's topic, who's the typical patient and what are the different procedures you do? I guess you've restricted your practice to dental implants.
Exactly. So Randy, what I'm doing primarily is I'm making people happy with new teeth, replacing teeth that are broken, damaged, things like that. But at the same time, my typical patient, the patient that I get the best satisfaction from, are people who have dentures, who are very unhappy with what they have, who have, whose quality of life is really diminished because of the way
their quality of life.
The quality of life is diminished because of how they are, because of their teeth or lack of their teeth. So these people come to me because they just have this desire, this really, really deep need to have something in their mouth that's permanent, something they can smile with, they can be confident, happy, chew well, change their life completely.
Okay, are there a lot of people with denture wearers in the San Francisco area?
Thousands of them. And we did some research about this, and it shows that in San Francisco area, which is, a very urban environment where people are educated and they've got jobs and they're active, they go to theaters, they have social life. There are so many of them, thousands and thousands of people who have no teeth and they have dentures and they're living with this handicap, unfortunately, not knowing that there is a better way of living.
So when we say at the top of the show, no more dentures, you believe that? That's
Absolutely.
The future.
That's the way it should be. Our life is so precious. We have to live it to the fullest until the very last day. And the way to live it is having teeth in our mouth. And I believe that this day and age, we are capable of bringing people this immense satisfaction from being able until the very, very last day of their lives. So these people can eat, they can smile, they can kiss, they can do all sorts of things I can't mention in the show. But at the same time, it's going to be an incredible boost to their self-esteem and also to self-esteem of their loved ones. Because seeing their parents and their grandparents at the later stages of their life being so capable is an incredible feeling, because that's how you perceive yourself in the future.
Okay, good. Now, a little bit about your background, okay? You are, it's a big title, but a master of oral implantology.
I love that word, yes.
Or something like that?
I'm affiliated with International Congress of Oral Implantologists. This is the biggest organization in implants today. And it's across the globe. People share information, share knowledge. You have to go through a certain process to become a master and acquire that knowledge and be able to pass it on to your colleagues.
So you're a master of this?
I'm a master, yes.
Okay, good. Now, you have this in your blood, right? I mean, your grandfather, uncle, great-grandmother,
yes,
dentist.
It's infectious, absolutely.
And would you say the happiest, in fact, I think you told me this, the happiest group of patients are those that you can replace their missing teeth
Absolutely.
with dental implants?
Absolutely.
Why do you say that?
Because they've suffered enough for a long time, and they had to overcome certain psychological barriers where they had no previous knowledge of what implant dentistry can do for them. And for them, it's a discovery, number one. It's an awesome change in their life. And they feel so happy, so encouraged to be able to play with their kids and not worrying about dentures coming out of their mouth, to be able to chew food in a social gathering, to be able to just be themselves, to open up. Because once you're afraid that something's not quite all right in their mouth, that just kind of cringes your whole being into a small, tiny pellet. But at the same time, when they discover what implants can do for them, they brighten up, they open up, their lives change.
You see it? I mean, once you give people their teeth back.
Absolutely. This is the most incredible feeling you get, satisfaction you get when you deliver that bridge or that denture to that person, and they're in disbelief, there are tears in their eyes. And that comes from a long wait and long disbelief that something like this can never happen to them. I got to tell you an incredible story. Yes, people tell me about how they were not able to eat, how they were not able to smile, how things change in their social life and their personal life. But the story I remember the most is when this lady came to me, the older lady, and she said that when she was a kid, she remembers her grandma, who was sitting at a table and not eating much. And her face was, very beautiful. And one time she walked into a room and caught her eating something without her dentures because she could not properly eat with her dentures. And she saw a completely different woman, very old, and she was really scared from this impression. And she realized that from that point on, she felt that she would have the same fate when she grows up. She will not have teeth at the age of 65. And then at some point when that happened, she decided to do something about it. She did research, and she had her teeth put in with implants because she said that she didn't want her family, her daughters, and her grandkids to perceive themselves as old people at that age, because it's all about legacy. And she wanted to be remembered for being young, energetic, a little nutty, as she said. And that's incredible. That put tears in my eyes because I felt that she was able to continue her life and give an example of that life to her family.
So this woman had dentures when you met her.
Yes.
And you gave her a fixed set of teeth on the lower and the upper?
Exactly.
Interesting.
Yes.
How soon can they eat, by the way, if everything goes well?
They can eat right away. Being cautious as I am, I always say to them to start slowly, to start eating softer foods, but very soon they'll be able to eat food of their choice. Steaks, burgers, anything you want.
Do people tell you their eating stories? Ever?
Yes, all the time.
Are they ever afraid?
They're not afraid anymore. Absolutely. They're afraid initially when they first have their first lunch or first dinner and first steak. They're very cautious about what's going to happen. Their whole being is focused on their chewing. But then they realize there's nothing moving. The food goes in very well. It's all, the nourishing process is taking place, and it's just amazing for them.
How old can you be? Is there an age limit?
No, the oldest lady I've placed implants for was 8 implants for this lady. She was 93 years old, and very feisty lady, and she wanted to have teeth on implants that wouldn't come out when she eats, and we placed 4 implants on the top, 4 implants on the bottom, made her a denture on the top, a snap-on denture on the top, a snap-on denture on the bottom. She was happy as a clam. She was just incredibly grateful that she's finally able to chew without putting any glue inside her dentures, that these dentures, didn't fall out of her mouth.
So they lock in.
They lock in. They just snap in.
out.
It takes a little bit of effort to take them out, and we, depending on person's dexterity, we change the housings inside to a certain degree of stability, so they can take them out with comfort and put them back in. But they will stay no matter what.
Is that right? I mean,
Absolutely.
if you make a fixed set of teeth for these people, like in their 80s, because 80's young today.
Absolutely.
Could they eat a carrot, like bite a
Yes,
carrot?
they can.
Or bite an apple?
Absolutely.
You don't have to be careful?
No, you don't have to be careful.
Really?
Absolutely. Yes.
Like broccoli, salads?
Broccoli, anything they want. Once this denture is complete and the bite is adjusted, they can eat anything they want.
Now a 90-year-old. You said a 90-year-old,
Yes,
right?
yes.
Seems like a lot of pain for the 90-year-old. Also, it seems that at that age, is it more likely for the dental implant to fall out?
No, there is no difference whatsoever. Bone is bone. And people have this misconception that as we age, our bone changes to the degree that we cannot place implants successfully and the bone will reject them. But this doesn't happen.
There's data to support this.
There are people in their 80s and 90s who have these implants placed, and they're incredibly happy.
You did say earlier in the program that in San Francisco that there's tens of thousands, maybe even 100,000 denture wearers, people that have an upper lower denture. If it's so good to replace, to lock in their denture with dental implants, why aren't they all doing it? What's your take?
Interesting question. The reason they're not doing this is because they haven't been to dentists for a very long time. They have dentures. That's all they think they deserve. That's all they think they're going to live with, and they just don't know their options.
Okay.
Second of all, people who have dentures, they went through hell going through dentists and doing root canals, doing extractions, doing all sorts of things to save what they had. They went through partial dentures, through bridges. All these experiences made them afraid of going any further. They finally have dentures and they don't want to even deal with anything. They'd rather
So
go
before false teeth,
right.
so is it a fear?
They're
afraid of the
exactly.
dentist?
They're more afraid of pain. They're afraid of living the way they are, even if they're so unhappy. And this is complete false.
It seems painful, though, respectfully.
It seems painful, but it's not.
Like, what do you give them afterwards?
You give them afterwards? You mean after the
Yeah,
procedure?
after the procedure.
Just ibuprofen. These people have it done under local anesthesia. They're very surprised about that they battle the idea of going through major general anesthesia, but it's all done under local, and I'm able to numb them completely. They may get a pill or something to relax, like Valium, but at the end of the procedure, they're surprised that it went so well and nothing is hurting. They leave on their own with a family member. I called the next day to find out how they are, and predominantly, they say to me they were incredibly surprised that they had to take only one pill and maybe another one just in case, but no reason whatsoever, and they're in shock. And they're thinking that had they known about this a long time ago, they would have lived their life a little bit better having these implants done years before.
Interesting. Very good. So people don't like going to the dentist. Do you hear that? Did they tell you, no
Absolutely.
offense, doctor?
Absolutely.
How do they say it?
They feel very apologetic, and they say, yes, I know, it's probably the worst mouth you've seen in your life. And I say, no, it's not. and they say, well, but I got to do something about it because my teeth are all falling apart, and I'm just afraid that about implants, and it seems like something has to go into my bone, and it's going to be painful. It's not. There was research done comparing implants to root canals and extractions, and implants are just very, very simple from the pain standpoint procedure. As far when it comes to extractions, when you deal with infected tissues, when it comes to root canals, this is something that puts people off, and they start fearing that implants is just the most barbaric procedure that can be done to them. So a lot of the people
would do it, but they've got these beliefs.
They've got these false beliefs.
Like, I'm too old.
I'm too old, or it's going to be very, very painful, and it's just this very drastic procedure that I'm not sure I want to undergo.
But it is true, though. If you've been wearing dentures like 30 years, you don't have enough bone to do this. Is that true?
It's not true. There are situations where people do miss some bone that can be grafted, can be added to the existing bone without any particular complications. But in many instances, this is something they've been believing for a very long time, based on somebody's opinion or based on what they've heard or read elsewhere.
Do you have patients that come to you that say, I was told I don't have enough bone?
All the time.
Really?
Yes.
That I can't get dental implants?
Yes.
Really?
Absolutely. All the time.
Well, then what are you doing that's so special that you're able to do it and somebody else can't?
Well, first of all, they've been diagnosed by people who are not specialists in the area. Somebody who just who touched their bone and said, well, your bone seems to be inadequate, you better wear a denture. When they come to us, we do a complete diagnostic.
So they don't have experience.
They don't have experience.
Okay.
Somebody tells them, oh, you may have a bad bone, or some dentists who don't do implants. They say, let's not do implants. They fail. They sometimes cause pain, complications. Okay. Let's just make you a denture. You use a glue. Be happy about this. That's what I've been hearing for a very, very long time.
You don't like dentures at all, do you?
I hate them. Absolutely. This is not this piece of plastic should not be in people's mouth.
Is that right?
Or at least it can be in people's mouth, but have to be supported by implants, because that's what makes them stable, and people get used to them really fast. But without implants, it's a nuisance.
So you're not too old, I guess, to get them,
no,
right?
No.
And you say it doesn't really hurt.
It doesn't hurt, no.
I mean, some people don't complain about pain at all?
People are different, and there are some who are extremely phobic. And when they're phobic, they expect that pain to occur. So we have to use lots of anesthetic. You have to be really cautious about how to approach them, how to work with them, be more patient. But at the end of the day, they call the next day when I called, they say, doc, I was thinking I was hurting, but I wasn't. I was just very much afraid. And I hear this all the time, especially from people who've been postponing this for a very, very long time. It's absolutely incredible to hear all these stories.
Now, you say the people in one day you could transform their lives.
Yes.
You believe that?
Yes. One lady, 66 years old, she lost her husband to cancer earlier. She decided not to give in. She wanted to date. She wanted to find somebody special. So what she did, she started buying clothes. She started doing makeup. She started doing all things around herself to beautify her face and her body. And then one day she realized that the smile is the one dress that never goes out of style. She realized that no matter what she puts on her body, on her face, the main thing, the main focus of her personality is her smile. And that's something that she was lacking. And when she came in, she wanted to have all her bad teeth taken out because they were all in different, they were damaged and they're broken and things like that, and yellow. And we did 6 implants on the top, 6 implants on the bottom. We did full ceramic bridge on the top and the bottom. Her whole being has changed so dramatically, even though she was very nicely dressed, and she was really a soft-spoken person. But after we placed those teeth in place, she became, her personality changed. She became more gregarious. She became more talkative. She became more nutty. She just discovered her whole new personality. I'm in contact with my patients because they come for subsequent visits. We have very friendly relationship. We call each other, greet each other for holidays. And I know of her life right now. She was able to meet a very interesting and very sophisticated gentleman that live in Tiburon. And they're a very happy couple. They travel around the world, and she's just as beautiful as ever, but with one addition. She has an incredibly beautiful smile. She just can't stop smiling. She can't stop hugging me and clenching my hands. And it's something that just makes you so happy.
So when you take somebody that never smiles,
right,
and now they're smiling,
yes,
I guess it like adds to their charisma.
Absolutely,
in a way.
Absolutely.
So this is like cosmetic dentistry as well.
This is the charisma. It comes from the smile.
Now you're a dentist, so you think that let me guess, that the smile is one of the most important things.
Not because I'm a dentist. I notice people around me in restaurants and places like that, and I see people who are just very good-looking people in their 60s, 70s, and 80s. Everything works. Dress, expensive bags, shoes, but then they smile, and you see that there's something lacking there. And
like old teeth.
Old teeth that are just not paid attention to. But then you see another person who has all that and a beautiful set of teeth. It's a beauty walking by you, making everybody happy. Because when you see a good-looking person at any age, it gives you incentive, I think, and myself as well, that when I'm going to be at that age, I can look good. I can play golf, or I can do a bunch of things, but my social life is not going to stop, because I will be happy to share my smile, my charisma, my attitude with other people. It makes you a better person in a way. I would say that, absolutely.
It is true, that you mentioned that. Like when you see a 75, 80-year-old, which is young today, and you see that beautiful smile,
right,
it's like almost exudes health.
Yes.
Like they're healthy.
Absolutely.
Interesting.
It's a dress that never goes out of style, 100%.
You take them wherever you go.
Absolutely.
So now, the group of people, and we're talking, and for people just tuning in, we're talking about replacing missing teeth with dental implants. My guest here says no more dentures, that nobody should be wearing a loose-fitting denture. That would just like a couple of implants, right?
Yes.
2 or 4 implants, give them something that locks in their mouth.
Absolutely.
A full arch of teeth.
Absolutely. Absolutely.
Now, what about the crowd of people that their mouth is falling apart, right? They have gum disease, and they know they don't want dentures. Mm-hmm. Are their gums too bad for dental implants?
No, the gums...
What do you do for them?
Well, gums are bad because they have teeth. Anatomically, teeth have a tendency to develop gum disease because they have this ligament, the attachment of the teeth to the gum and to the bone, that is suffering. And people think that if they have this gum disease with their teeth, that when they have these teeth taken out and implants are placed, it's going to be the same fate. It's completely false idea.
So you clear up the gum disease
Clear up,
first.
exactly. You take these teeth out, you clean the bone, you clean the gums. Then once implants are placed in, they have the whole new start.
And they have good gums again.
And have good gums, absolutely. Once implants are placed properly and you respect anatomical entities around the gum and around the implants, then you can expect these implants to last for a very long time, and these patients not to suffer the same fate that they had with their teeth.
So some people, you say, come in and their only goal is to eat better or get out of pain.
Right.
And then the other one, some people just want a beautiful smile.
Yes.
Which one do you like working with?
I like working with both. Some people are just very straightforward and they want to have both. I want to have a better smile, beautiful smile. I want to go to on cruises and dance with my girlfriend or companion or wife. And other people want to have ability to chew and eat very well, but deep in their mind, they still want to look good, even though they don't want to admit it. But once they start chewing, eating better, just what they wanted in the first place, then within 2 weeks after they leave the office, they start getting compliments. And when people start looking at their teeth, they don't frown, but they have this sparkle in their eyes because they see that there's something very, very beautiful that they're talking to. It's an incredible feeling, really. And when they come to see me and I have pictures before, pictures after, and I see them, and they start actually dressing better. They start paying attention to the way they are amongst people. They start going out more. It's the whole life changes. This is the most incredible feeling.
Good, good. Okay, so, and we're almost out of time. So if people are losing all their teeth, or if people are wearing dentures,
Yes.
you say no more dentures, come in and get them attached to
Absolutely,
something.
yes.
And that's a future, you say,
Yes.
of dentistry. Now, the way you do it, you explained to me. How it's normally done when you get dental implants for a denture wear is you go to one place, is the surgeon,
Right.
then you go somewhere else, and they put the crowns on top or the teeth on top.
Right.
You do both parts.
Yes.
Aside from convenience, is there an advantage the way you see that?
Absolutely. The way I do it, I plan the whole thing from the very beginning. I know where to place implants. I know their bone density and their bone condition, height, width, all the aspects of their bone based on the CT scan we do prior to the whole procedure. Then I plan. I know how many implants I need to place. I know at which angles to place them. And my planning is based on the end result. I don't have to communicate or miscommunicate with a prosthetic dentist or having two people involved. It's only myself. I know where to place implants. I know having the end result in mind. And I think that gives a patient incredible advantage. Second of all, they deal only with me. So they know that I'm the guy who's responsible for making their wishes come true.
So do you think the fact that you do both parts, you could pass the savings on to the patient?
I think so. Absolutely. Absolutely. That's number one. Second of all, I do want to do what I do and not to break somebody's bank. I really feel it's important to deliver good services and not to overcharge people. And that gives me personal satisfaction.
Okay. Now, insurance does not cover the whole dental implant process, or Medicare doesn't cover dental implants. Is that right?
That's right. But there are some instances when insurance partially cover implants or dentures or crowns. But we try to make it affordable to people, number one. We try to, because we're one center that does all services from start to finish. It definitely helps as far as the ultimate cost of the procedure. Second of all, we offer financing through a care credit. So if you have good credit, we're going to be able to sign you up and you'll be able to afford this treatment without any problems.
Okay, we are out of time. But for the denture wear, give us a recap of the options as far as dental implants to secure their denture.
Right. One option is when you have two implants and a denture. One implant placed here, the other one placed here. The other option, you can add one more implant in the front, or you can have two implants on each side and the denture snaps on and snaps off. No matter how many implants you place, this denture is going to be very, very secure. And there are some limitations to the number of implants you place and how the denture is holding. But to satisfy people's budget, you can place from 2 to 4 implants to have the snap denture in place. The next level up is when you have teeth that you place on implants, they don't come off, they just stay in place. These bridges can be placed on 4 implants, which is called all-on-4, or it can be placed on 6 implants when you have several incremental bridges that are placed next to each other and they replace all missing teeth.
They can eat whatever they want with those.
They can eat whatever they want with us. They can eat whatever they want with dentures as well. But
you mean with the snap in,
with
snap
the snap
out?
in, snap out. But the advantage of the bridge is that bridge stays in place. It doesn't come off.
They could eat corn.
They can
like
eat
on the
corn,
cob.
cob, absolutely. Steak, you name it.
Is that right? Now,
Absolutely.
You don't like just 4 implants to give a fixed set of teeth. You like to go like 6.
Exactly. This is the old-fashioned way, and I respect technology and innovation, but at the same time, even though it has its own advantages, all-on-4, but I believe that when you have more implants supporting several incremental bridges, you have a better success rate in the long run.
Dr. Skorupko, we're out of time. Final message to somebody, I guess they want to avoid false teeth, or they're wearing a denture, but maybe they're still skeptical, right? It sounds like it's painful, or they're too old. What do you say to them?
You're not too old for anything. That's number one. Second of all, implants isn't the future. It's now. You have to take full advantage of it. It's less expensive than you think. So if you've been given very high estimates and you come to us, you will discover that it can be affordable. Pain should not be a factor. It should not be something that's stopping you, because we're going to do our best to help you without you feeling pain.
Now, what about the consultation? So you are offering a free consultation.
Absolutely. We offer free consultation, not just one. So if you're doubting and you came for a consultation, but you're still skeptical, you can come second time, the third time. There is no charge for having a conversation with you.
Now, there are tens of thousands, 100,000 people with an upper lower denture.
Right.
If they all decided and believed what you said on this program, you guys couldn't even handle the business,
we
right?
No. We'll deal with that later.
And they all would do it, though, in your opinion,
Yeah.
if they knew how good it was?
Absolutely. Absolutely. I have no doubt about this, because I have experience with people who were skeptical for a very long time, and they deprived themselves of beautiful living that implants give them.
Okay, good.
Yeah.
I want to thank you for coming to the show. Very good. Great information.
Thank you so much.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.